Today I want to talk to you about a non-surgical option for chronic joint pain and ligament or tendon damage. It's estimated that around 20% or 1 in 5 Canadians is suffering from chronic pain. This is a huge amount of the population that's struggling day to day just to get basic things done, whether it be walk, getting in and out of the car, navigating around their homes. Chronic pain is a big deal, and I want to talk to you about, like I said, that non-surgical option that a lot of people don't know about. It's called prolotherapy, and what it is an injection technique involved at restructuring ligaments and tendons and helping get rid of joint pain like really fast. So what it is it involves an injection of a sugar solution combined with a numbing agent called lidocaine. And then what we do is we find the injured area, let's say the shoulder for example, and the needle is inserted and the dextrose and procaine solution or lidocaine solution is dropped into the site. And what it does is it sets off like a mini fire in that area. A tiny little fire, and then what the body has to do is send out all these fire trucks to that area. Not only to put the fire out, but then it allows them a chance to bring in all the extra helpers. All the bystanders, everyone else around can then help not only restructure but remodel that area and then allow the ligaments and tendons to heal properly, and then that'll go a really long way in not only reducing joint pain but improving function across that joint. The reason ligaments and tendons are such a problem is because unlike muscle, which has a rich supply of blood, ligaments and tendons have a very poor supply of blood. So when they're injured, for example, say you roll your ankle and you stretch some of your ligaments, when those ligaments are injured, because they have a low blood supply, they not only take much longer to heal, but that signal that's being sent from your ankle to your brain can be ignored after some time. And once you enter into that 3 to 6 month period, the body now senses the signal there but is not doing anything about it to help heal the area. So you have a signal that's not being dealt with, poor blood supply to a tissue that needs it to heal, come back stronger, and then a joint that's now causing you pain and dysfunction. What happens when ligaments are overstretched is they no longer can support the bones at a joint and hold them together properly. This puts extra stress on the muscles surrounding that joint, and instead of just moving that joint, they now have to hold things together. So that's why quite often when we have instability across a joint, we're often found with very tight, uncomfortable muscles that actually don't really help us move the way we need to. And then as a result, you're stuck with chronic pain. So what prolotherapy does is it gets right into that damaged tissue, starts that mini fire I was talking about, and then the body can send all the help that's required to kickstart the healing in that area. A lot of people think inflammation in an area is a bad thing, and of course chronic high-grade inflammation in any area is going to be bad and detrimental to the tissue. However, in a chronic pain state, or when we have ligament laxity and a poor blood supply to that tissue, what we can do is just send a spark in that area that allows the body to not only send what needs to go there so we can repair that tissue, but get the person moving and feeling better almost instantly. What we find is if people walk in with chronic pain or pinching or essentially that dysfunction across a joint, within 1 to 3 sessions we can have them moving and feeling up to 80-85% better. And in this day and age that is absolutely huge, because chances are a lot of these people are candidates for surgery. They're very scared and they're not sure, like, do I want to go under the knife or not? Or perhaps they've tried many other things and had just really no luck. So when the frustration is high and the options seem like, wow, what am I supposed to do here? Like, do I want surgery or do I want to live in chronic pain for the rest of my life? This is where prolotherapy comes in, and it is coming up more and more these days. It's becoming extremely popular. I urge you to check it out. If it's something you've been living with a long time with respect to chronic pain, this might be the cure for you, and it can completely change your life.